whatever necessary steps that we need to seek justice, we are going to do that.
Tonight on Nation to Nation, this residential school survivor refuses to be forgotten, and that means going back to court against Canada.
The churches and Canada, especially Canada, have to be accountable for what they did.
Getting justice has meant facing the abuse she suffered in this former rectory of the Kamloops Residential School.
It was only about 4 years ago that I really faced the truth of what happened to me.
I'm Todd Lamoran, and welcome to Nation to Nation. Canada has a massive collection of residential school documents in a searchable database. They tell the story of a dark stain on the history of this country, one that is still being felt today. But this database requires specific search fields to access the documents, and Canada doesn't want to give up that access. In fact, Canada is currently fighting survivors of residential schools in federal court from getting it. The case involves what's known as day scholars. They're status Indians who attended residential schools, but unlike children often sent far away to boarding schools, they returned home every night. To talk about how Canada is fighting day scholars is a key plaintiff in the case, Joanne Gottfriedson. She attended the Kamloops Residential School. Ms. Gottfriedson, welcome to Nation.
Good morning, and thank you.
First, could you explain what the day scholars class action is and how it's different than the day school class action?
The day scholar class action is a class action that was certified for individuals who attended a residential school during the day and went home every night. There had to be a residential school. There had to be students living there. A day school, the difference is that there was a school on a reserve, but nobody lived there. And that's the big difference.
How did it feel, though, to see the day school's class action settled, considering it was filed years after yours?
It was very disheartening because, Kamloops and Sechelt filed this class action together. We worked diligently to prove, and then when the day school was certified, shortly after they started their certification, was very disheartening to our people, because to me that was another slap in the face. Why is not the government honoring justice for day scholars and still putting all these stall tactics in front of us?
So the day school fight is coming to a close as they've got their settlement, and probably going to be payouts pretty soon, as yours is back in court because the Justice Minister doesn't want to help you access residential school documents. What's this all about?
Well, Canada continuously does not want to look at the truth of our people. They don't want to acknowledge the history and the impacts that they had in regard to Christianizing and civilizing us, let alone putting us in an institution that raped us of our language and culture. And they continue to roll down that path and not acknowledging that. And now, as we go into court, they're still putting stall tactics in front of us. They're, appeal after appeal. They're calling this and that, and we're meeting every criteria and trying to advance this justice for our day scholars is vital for our absolute wellness and the restoration of our language and culture.
I mentioned in my introduction about this database of documents with search fields. First of all, how would that help your case if you could access that?
Well, the information that's housed with Canada would give us the opportunity to be on a legal fair field for our class action. First of all, there are important documents that our people deserve to have access to. And also, those horrendous treatments of our Indigenous people are noted in those federal documents. And even though the churches were employed They're still employees by the government, and the government is responsible to ensure their fiduciary responsibility to look after and ensure the wellness and safety and the protection of Aboriginal people. And they are not doing that by not allowing the truths of history to be shared, not only with us as day scholars, but as Canadians and the world as well.
Now, we talked about appeal after appeal. The latest was filed in late March, just as the COVID-19 pandemic was spreading across the world. I suppose, how did that make you feel, these two things coming together at the same time?
Well, I try not to be angry. My desire to seek and obtain justice is vital. So, of course, it's really devastating, but it's also empowering to know that whatever necessary steps that we need to seek justice, we are going to do that. Whether it's fighting through the litigation process of securing that evidence and obtaining those documentations, I can't say that I'm happy with the process because, needless to say, our day scholars are dying. I'm 68 years old, and I hope that during my time, and I plan to live to be 100, so Canada better pull up their socks, recognize the fact that they've done wrong. And I want to share this too, because at the AFN, I approached in public Minister Bennett and asked her. She personally made a phone call to me agreeing about the 10+3. I'm not going to hold my breath for that, but I'm still holding faith and hope that Canada will deal with the day scholar issues in a fair and just way and as soon as possible.
As you mentioned earlier, and why you want to see this done as soon as possible is survivors are passing away, including your late sister Violet. What do you fear may happen if this pandemic gets into a vulnerable community like Kamloops?
Wow. Since this pandemic has gone on, our wellness in our community is greatly affected, big time. And one of our descendants was passed away. And it's very disheartening that Canada is still continuing to hold us as hostages, really, is what they're doing. We need and deserve wellness. We need and deserve that great pride. My sister Violet died, but she had that hope that we would have justice for our people. She encouraged me to continue the work, and whether I'm sitting in that office or wherever I am, I'm going to continue to fight for justice for our people. We deserve it.
Of course, when we first met you in late 2018, you took us into the rectory of the former church at the Kamloops Residential School. Can you explain why that experience made you a key plaintiff in this case?
That part of my life in my it was only about 4 years ago that I really faced the truth of what happened to me. I had this burning desire to make sure that our people, no matter what level you're at in life, the churches and Canada, especially Canada, have to be accountable for what they did. Sharing my story was not an easy thing. But my sister died knowing that our fight would continue and we will get justice for our people. And we need that right to practice our language and our culture. And that's the driving force behind this whole case. And that is exactly why I shared my story. It wasn't easy, but it was necessary now as I see it, as I grow.
Of course, since you shared that story, what toll has this all taken on you and these continued delays in the case?
Personally, it is enhanced, and sharing with my immediate family has made us grow even more stronger. But it's also gave me the courage and the more push and willpower to obtain justice, to get our day scholar class action settled. And I've been quiet for a while, but no matter who's behind the driving force, there will be justice for our people. And all I can say is that this is the path to wellness for our people. We've suffered enough. We need to walk with pride and grace and honor. We deserve it.
Now, it looked like you're very close to settling this in mediation. You were a co-negotiator with Matthew Kuncombe. What do you think went wrong?
We fought really hard. But Canada always put a stumbling block in front of it. It's a simple solution. We're only asking for the same settlement that the former residential school obtained, 10+3, our descendants, the opportunity to healing. And I think that Canada has a really difficult time wrapping their minds around our band class. There was an opportunity for bands to opt in, which they did, and continuously, putting stall tactics in. We asked for a special minister representative. We got that. We were under the understanding that we're in negotiations for settlement. Then Canada put roadblocks in. Now we're again facing a litigation process.
Well, Ms. Gottfriedson, it's great to talk to you again, and I hope something gets settled soon. Thank you for speaking to me.
Thank you. After
the break, Indigenous Services will speak about the lack of COVID-19 data for Indigenous people. Welcome back. It's no secret that the federal government doesn't have an accurate picture of how the pandemic is playing out in the Indigenous population. And Indigenous Services Minister Mark Miller admitted that this past weekend. In response, he pledged $250,000 to partner with St. Michael's Hospital in Toronto to get better data. Recently, the Yellowhead Institute published a critical look at the absence of data. It tallied 465 cases in 42 communities and likely 7 deaths. To address that and more, I'm joined by Valerie Gideon, Senior Assistant Deputy Minister for the First Nations and Inuit Health Branch, and Dr. Tom Wong, the Chief Medical Officer for Public Health at Indigenous Services Canada. Welcome, both of you, to Nation to Nation.
Thank you.
Thank you.
Now, I know we've talked about this gap in data many weeks now here on Nation to Nation. So when the Yellowhead Institute published its figures a few days ago, and they were roughly 2.5 times what Indigenous Services reports, was that a surprise?
So from our perspective, I would say we know that Indigenous people live all across Canada. They live across all of the current jurisdictions. And so they also potentially share some degree of vulnerabilities, such as higher rates of chronic disease, higher rates of poverty. So I don't think it is a surprise that there would be more cases than what we currently track within our department in terms of First Nations that are living on reserve across provinces. But I would say that we do have to be cautious about just taking a geographical area that may be predominantly Indigenous and just assuming that all of those cases are Indigenous people. So I do think that it is important to have some rigor with respect to how we go about improving surveillance and research in the area of COVID-19. The $250,000 that our minister spoke to on the weekend is to fund the First Nations Information Governance Centre that has a mandate for data collection and analysis under First Nations governance across First Nations communities in Canada. There is a strategic alliance with First Nations, Inuit, and Métis researchers that is being coordinated out of the Toronto Research Centre. And we have a lot of support for that type of a partnership where the data collection and analysis will be led by First Nations, Inuit, and Métis. I'll turn it over to Dr. Wong for further comment.
Thank you for the question. Beyond First Nations living on reserve, it is anticipated that there are many more cases among First Nations, Métis, and Inuit with COVID-19 all across Canada being reported to the provinces and territories. An accurate epidemiological data collected by Indigenous Services Canada is currently only available for First Nations living on reserve in the provinces. However, we need help from provinces and territories, as well as from public health agencies, to support Indigenous people in order to obtain a comprehensive picture all across Canada.
Do you consider the figures that they came up and that they reported on to be accurate?
I would say that without further detail with respect to the specific methodology that they undertook, we really can't comment. But it does seem from the report that they used sort of a general geographic location and extrapolated from that that all COVID-19 cases would be Indigenous without necessarily validating the identity of those specific individuals that were affected with COVID-19. I don't know if Dr. Wong has also further comment.
Yes, I concur with that comment as well. It is anticipated that there are many more cases, and I think that the methodology can be fine-tuned even further in order to identify the burden of the disease, for example, in urban First Nations, Métis, and Inuit peoples.
We've talked a bit about their methodology. I don't know if this is a similar methodology or something different is what you're going to expect to get from the $250,000 that was promised to St. Michael's.
The $250, as ADM Valerie Gideon just said, that funding is for First Nations Information Governance Center, FNIGC. That specifically is to identify ways to get at First Nations, both on reserve as well as elsewhere, in order to analyze the data with the support of ISC and other federal government departments, as well as provinces and territories. We hope that this is a way to support First Nations-led and Métis-led and Inuit-led initiative in order to collect, analyze, and model the data.
Do we know when it will start producing better data?
So they have started already with respect to the planning work. I think they will take a few months in order to be able to develop their full methodology, but I would say that their intention is absolutely to ensure that the data is as high quality as possible and is validated by the First Nations, Inuit, and Métis organizations, so there is not a misrepresentation of who is Indigenous and who is not within the context of this research. I think that they will require more capacity and more support in order to be able to achieve this, because unfortunately the public health data that is currently being collected through provinces and territories will not necessarily offer quality data once it's disaggregated specific to the Indigenous population, which is only possible in some jurisdictions in Canada. So they will have to do their own data collection tools, which will be done by Indigenous researchers in order to be able to supplement what is not currently being done through some provincial and territorial jurisdictions.
It's been reported that Dr. Janet Smiley of St. Michael's was caught off guard when Minister Miller made his announcement on the weekend and mentioned her by name. How did that happen?
So we are having constant, I would say, weekly discussions with Dr. Smiley. We have been briefing, of course, our minister with respect to this initiative. And I think that, it is an initiative that we've spoken about as well with external partners, such as the First Nations Information Governance Center. We've spoken about it when we are asked at the Chiefs Committee on Health of the Assembly of First Nations. So it was information that was in the public domain, I would say. But we are working closely with Dr. Smiley for all future communications to ensure that she has an opportunity to input into it, as well as the other researchers that will be part of this team and are part of this team.
How do you base your decisions then on who to help when you really don't have a true picture of what's going on out there yet?
Well, our responsibilities, of course, are very much focused in First Nations communities in terms of direct primary health care and public health responsibilities. And in those contexts, we do have an accurate sense of what is happening with respect to the number of tested positive cases on reserve. We are also very grateful to be looped into the Inuit Public Health Task Force, where all partners with respect to Inuit leaders and representatives across Inuit Nunangat, as well as provinces and territories, do participate and discuss what are the priorities and the response efforts in support of the Inuit across Inuit Nunangat. We also have regular briefings with representatives of the Métis Nation as well to hear from them what they are hearing from members and what are their priorities and challenges.
Okay, on that, I want to thank you both for speaking to me. Thank you.
Thank you.
Thank you.
We'll have more after another short break. Welcome back. During today's regular COVID-19 briefing by cabinet ministers, Dr. Tom Wong used on-reserve data in his opening remarks. That there have been 185 cases, 18 of them requiring hospitalization and 2 deaths. He used that to make this observation.
We are cautiously optimistic that nationally, the First Nations on reserve curve continues to show signs of flattening if there's no future spread of COVID in First Nations communities. This has been accomplished by impressive First Nations leadership and decisive actions in using public health measures, including lockdown, physical distancing, prompt isolation, avoiding crowds, hand and cough hygiene, and it has paid off.
He did admit there are many more cases in Canada affecting Métis, Inuit, and First Nations people living off reserve, but since the responsibility of reporting those cases lies with provinces and territories, Dr. Wong made this plea.
We need help from provincial and territorial health departments and agencies to support Indigenous peoples to get a comprehensive epidemiological picture beyond First Nations on reserve.
That's all the time we have for this week. I hope that everyone is still staying safe and healthy. I'm Todd Lamoran. Thanks for watching.